my name's Nadine and I am a registered physiotherapist with advanced training in cancer rehabilitation. Last week we explored the question, can any cancer patient start exercising? We talked a little bit about what is medical clearance and when it's necessary. Today we're going to explore how to exercise with cancer, talk a little bit more about the details in that, so that if you've obtained medical clearance or you went through our decision-making tool and you know you can get started, through today's video you'll hopefully understand how you can exercise safely. So I hope you enjoy my presentation. All right, so here we go. Exercising with cancer, how and why. So today we will really explore that question, how to exercise with cancer. Let's start off with our friend Sam. Sam is 58 years old. He has advanced prostate cancer. He also is undergoing treatment presently, hormone treatment as well as chemotherapy. Due to his cancer symptoms and his treatment, Sam is experiencing fatigue. He's pretty tired most of the time. He's also experiencing pain. Some pain comes and goes. Some pain in his abdomen and in his legs is kind of steady. He's also experiencing loss of strength and just general loss of stamina. He also has waves of nausea that come and go. Now, if you were to meet Sam and you were his close friend or his family relative, and he was telling you he's experiencing all of these symptoms, I think we'd all be pretty tempted to say, Sam, it's okay, just rest, watch Netflix, lay down. Maybe you could walk around the block if you want, but don't push yourself. I think that that's definitely common knowledge and common phrase, but we're actually starting to learn that that's the opposite of what Sam needs to do. And that rest isn't always the best prescription. We're truly learning in a lot of areas of medicine that exercise is medicine, so that also applies to people with cancer. So if you were in Sam's shoes, would you want to exercise? Probably not. Do you think it would be good for you? Maybe that information isn't exactly clear. That's what we're trying to do today. So we know that science has shown that yes, exercise is medicine, but it's all about optimal amounts. We know that all cancer patients should avoid inactivity. That's pretty tricky when sometimes you're in the hospital and you're in bed all day. So for today's goal, we hope that you gain an understanding of how cancer patients can exercise safely and when clinical guidance may be needed. Let's start with the science, the exciting stuff. Well, we know that, unfortunately, I need to give this talk today because exercise requirements are not being met. Fewer than 10% of cancer survivors are active during their primary treatments. Although that study was done in 2012, it's highly unlikely that much has changed. And only about 20% are active after they recover. Only 9% of older adults use any kind of physical therapy services or OT services when they are on a cancer journey. So that's a very, very, very small percentage of the cancer population getting support. And we know that a vast majority of this cancer population have a modifiable functional limitation, which means they have a cancer symptom or some type of physical setback that actually isn't being managed. This could be pain, stiffness, fatigue, and some of these pathologies can be managed and we can make patients feel better. Continuing on with the science, we know that supervised exercise is statistically significant, clinically significant. It means that it has an effect. We also know that supervised exercise helps with quality of life and physical functioning. Now, quality of life was self-reported on behalf of patients, and it was described as quality of life including better self-esteem, better emotional well-being, sleeping better, less fatigue, less anxiety, and just better social functioning. We also know that through these research projects that were done, some of these involved hospitalized patients undergoing stem cell transplants. So can you imagine? You're in the hospital, you're undergoing stem cell therapy, and you're exercising. Sounds challenging, but all in all, it was reported to really help with quality of life and physical functioning. We also know that timing matters. Early rehab intervention is really important, and Dr. McNeely's research really highlights this, specifically in the breast cancer population. If a breast cancer patient starts exercising early in their cancer diagnosis, we see better shoulder functioning and range of motion. This can be so important when the shoulder has to go into certain positions for radiation. We also know that timing matters even in prostate cancer as well. There's some research coming out that's showing that if prostate cancer patients start exercising early, hormone therapy can be affected and better treatment can result. We also know that weight gain can increase the chance of lymphedema. As little as a 10-pound fluctuation can increase your risk. 10 pounds is difficult even for an average person, so even more challenging for a cancer patient to assure that their weight is staying steady. The biggest tool to help with regulating weight is regular exercise. The last little bit of science I want to talk about here, it's early science, it's young. There isn't that many studies, but enough for some really exciting things to come to the forefront. So I want to bring it up. There is some preclinical studies showing that physical activity can actually reduce tumor growth, as little as 30 or as much as 67%. Although this is young science, that's pretty exciting to think about. There's also early science that's starting to show that exercise may impact drug efficacy. What I mean by that is that exercise combined with chemotherapy can actually make the chemotherapy more effective, and therefore potentially dosages don't need to be increased. So what does all this mean for Sam? We know his cancer diagnosis. We know that he's having a lot of symptoms. We now understand that he should still get moving, and maybe more than just a little walk around the block. But how much? How often? What type? How intense? Does he need medical clearance? Does he need a physio? These are all valid questions. So the new guidelines that came out last year are really exciting, but I think we really need to create some clarity around them. The new guidelines state that 30 minutes of moderate to vigorous aerobic activity 3 times per week is exercise as medicine. It's also important to state that if a patient is fully deconditioned and has no exercise history, they really need to start slow and build up slowly. The second piece of the guidelines is that patients with cancer should aim for 2 resistance training sessions per week. But once again, if there's no exercise history or no resistance training experience, it's pretty important that these cancer patients pursue help from a physiotherapist or an exercise physiologist for safe entry to exercise. Once again, just to remind you that these new guidelines only apply to those who have been screened through the decision-making tool that I talked about in our previous video, or these guidelines apply to patients who have obtained medical clearance. So please refer to my previous talk about can patients exercise safely with cancer, just to assure that you've gone through the decision-making tool and that you're safe to get started. So I'm going to talk briefly about the next 2 slides because they summarize a lot of what I talked about in last week's talk. So really quickly here, I will keep this slide up for you to take some notes or to take a screenshot for your reference. But sometimes medical clearance is necessary prior to exercise, and you can see a list below of symptoms or pathologies that apply. If any of these apply to you, you can pursue medical clearance by an oncologist, family physician, or surgeon, or a physiotherapist with advanced training in cancer rehab. This can allow you to get started on exercising in a cancer rehab program. If any of the following symptoms or pathologies apply to you here, it is really important that you get medical clearance by a physician or an oncologist before getting started with exercise. Once again, I'll leave this slide up for a second so you can take a screenshot or make any notes that are needed. And once again, these last 2 slides summarize the decision-making tool that we talked about last week. So feel free to refer to that video to understand if you can get started with exercise and if you need medical clearance. So once again, it's really important to also consider that all exercise has contraindications and precautions. These are just fancy medical terms for saying there are rules for when you should stop exercising or not exercise at all. You should stop exercising if you have a fever that day, if you have a basal temperature of greater than 38 degrees. Also, if you are undergoing a cancer journey and you currently are consulting with an oncologist, it's likely that you're having regular CBCs, complete blood counts. Through this, there's a regular analysis of the next 3 bullet points, your hemoglobin, neutrophil, and platelet count. You don't need to memorize these numbers because we hope that your oncologist and family physician are familiar with them, but feel free to write them down or take a screenshot for your reference. It's important that you pass your complete blood counts and that your blood is in good levels prior to starting to exercise. It's also important that if you are exercising, that you regularly monitor your heart rate and your blood pressure. If you have a resting heart rate that's high that day, of greater than 110 beats per minute, it's best you don't exercise. If you have a blood pressure where the diastolic portion is abnormally low, lower than 45, or abnormally high, higher than 110 millimeters of mercury, it's also important that you don't exercise that day. If you have extreme fatigue that is beyond what you've been experiencing, or extreme nausea that is beyond what you've been experiencing, and a lot of vomiting, consider not exercising that day. If any of these symptoms continue for more than 24 hours, follow up with your oncologist, general physician, or physiotherapist with advanced training in cancer rehabilitation, just to obtain medical clearance and further testing to understand if it's safe that you continue to exercise. Let's talk about Sally. You see here, Sally is walking her dog. She has stage 2 breast cancer and she's been undergoing treatment as well, radiation and surgery. She's actually received full medical clearance from her physician to exercise and she has no complex health history. So the exercise guidelines apply for her. She can exercise for 30 minutes, 3 times a week, at the moderate to vigorous level. She can also undergo 2 resistance training sessions per week. And Sally has some history with strength training, so she's familiar with how to weight train safely. But what is this moderate to vigorous? Well, you can see here that Sally is walking her dog. So does that apply? Is that moderate to vigorous? Let's talk a little bit about that. The exercise guidelines really emphasize this level of intensity called moderate to vigorous. Now, if you have a heart rate monitor, you can use this to track your intensity, but a lot of people don't. So another tool to track how hard you're working and if you're following the guidelines is something called the RPE, the rating of perceived exertion. This is a scale based 1 out of 10 to gauge how hard you're working. And a way that you can do this is something called the talk test. If Sally was just walking her dog and walking with her friend and having conversations about her last week, and she was able to talk easily, she's probably working at about a 2 or a 3. If Sally started to walk a little bit faster and when she's trying to talk, she noticed that she had to take a little bit of a breath in between her sentence, she's probably working at maybe a 4, 4.5, or 5. If Sally was maybe walking up a big hill or doing a different workout and moving a little bit faster, and she found that it was pretty difficult to talk, and if she wanted to sing, she couldn't sing at all, well, she's probably working at a 6 or a 7. And that 6 or 7 RPE is what is considered moderate to vigorous. So the goal for the exercise guidelines is that you're working at a level 30 minutes, 3 times a week, where it's kind of difficult to talk, and you definitely wouldn't be able to sing to the music. So this is just a little pitch for myself. I'm biased because I'm a physio. And how can we help? Well, we offer clinical expertise. So if you have any physical setbacks or symptoms that are holding you back from exercising or moving freely in your body, lymphedema, pain, joint dysfunction, or post-operative complications, just to name a few, we can help set up a rehab program around that to move you forward and get you moving and accomplish your other meaningful goals. We also can help with safe exercise prescription, just to assure you're on the right track and that you're doing so safely. The last thing is we know that supervised exercise works. Science has shown that. So clinician-guided exercise produces the best results. We can help you connect with a rehab plan and also connect you with any connections in the community and services in the community that might best suit your needs. So once again, just coming back to today's goal, I hope that you've gained an understanding of how cancer patients can exercise safely and when clinical guidance such as physio may be needed. I want to say much thanks to all of the sponsors, research, and scientists that gathered last year to change the guidelines. After over a decade, it's really exciting to see these new guidelines come out. We've got a lot of people working in the community, in lymphedema specialists and exercise physiologists here in Victoria and on the island, and I want to say much thanks to them as well. I'm very inspired by all the work that everyone's doing to try to get these guidelines out there and to get people exercising safely. There's also some specific researchers close to home, Dr. Campbell and Dr. McNeely, whose courses I was able to take. It's because of them that I'm able to share this information today.
So thanks for tuning into our presentation.
I know it was a little bit long, but lots of useful information. At the end of this, you'll see a link once again to our website where you can obtain more details on our cancer rehab programs, but also you will see my personal email. Feel free to reach out if you have any questions at all about our program, about community programs, or referrals to other specialists like lymphedema specialists in the community. I'm more than willing to help, and I'd love to connect. Thanks again. Till next time.